As part of efforts to control the increasing numbers of COVID-19 and meningitis cases in the Upper West region, a non-governmental organization has deployed a digital technology to help educate rural communities on the two diseases. The technology, which is in a form of an audio device, is embedded with key local messages on the two outbreaks. The technology is deployed to over 200 health facilities in the region to enable health workers communicate effectively to residents in their local dialects. City News' Latif Mahama has the rest of the story.
The Upper West region has since February this year recorded a total of 258 cases of meningitis, with 4 deaths. The region has also recorded 7 cases of the novel coronavirus. As government strives to curb the two conditions, health authorities in the region say they are unable to squarely combat meningitis in the region due to non-adherence to safety protocols on the disease by residents.
Some of the protective and preventive measures, the cough etiquette and everything that we are preaching, the hand washing, people are not practicing it as expected because those interventions also work in preventing the spread of meningitis. So if meningitis is spreading, then it means there is something wrong somewhere.
In a bid to curb this challenge, Literacy Bridge Ghana, a non-governmental organization, deployed a technology to help sensitize the populace on COVID-19 and meningitis. Known as the Talking Book, this technology is an audio device used to record key messages in various local dialects on the two conditions and played at local health facilities and public places. The devices are deployed to 208 CHIPS compounds to bridge communication barriers between healthcare workers and their clients.
Access to information is what most vulnerable people across our operational areas need to take life-saving decisions. In view of that, Literacy Bridge Ghana is working closely with the Ghana Health Service in 8 selected districts of the Upper West region to combat the spread of COVID-19. Our strategy is basically leveraging the Ghana Health Service structures through the respective health directories and the CHIPS zones or compounds. We basically is delivering this intervention using our solution, which is the Amplio Talking Book device. Our solution makes it possible to effectively deliver information to rural poor people who need basic information to take the right decisions to protect themselves from contracting or from the spread of COVID-19.
Genevieve Yirpere, Health Director of the Nandon Municipality, one of the hardest hit areas in the Upper West region, says the Talking Book is a timely intervention as some health workers are unable to communicate key interventions in the local dialects.
We are all aware about what is happening in our country, especially in relation to COVID-19. So they came to our aid to support us massively to sensitize our population. In Nandon Municipal, our major source of sensitization channels is church and mosques, and we are all aware of the presidential directive. So because the churches and mosques are not in session now, the Literacy Bridge Ghana came at the right time because they deployed 31 talking books to their municipality to serve chips with compounds, 16 chips with compounds, and the remaining without compounds, which supports even volunteers to disseminate information. So these talking books are used to support our nurses and the volunteers during their home visits, their community meetings with smaller groups, as well as at the facilities. and during outreaches. While services are being provided, the talking books are sending out messages to our population.
Here at the Vapo Chips compound, I met Kipo Victor, the community health officer of the facility, who had returned from a sensitization visit to some villages where he used the talking book. He tells me the device helped in his outreach as he's unable to speak the Dagari language.
To me, I would say the benefit I'm getting from is because I don't understand the local language and it's very difficult for me to communicate with them. This thing has relieved a little pressure because they listen and they ask questions. And to them too, to their client too. At first when they come, even how you get them to sit down quietly and wait is sometimes a problem. But now they come, you talk to them, they sit down quietly, they listen, they ask questions.
Health experts say effective communication is key in the fight against the novel COVID-19 and meningitis in the country. The talking book is therefore expected to enhance sensitization on the spread of the two conditions here in the Upper West region. Reporting for City News, Latif Mahama.